surgery help transform your life?
Well, before the surgery, I didn't actually have diabetes myself, but I had a high risk of it. But I had respiratory problems, I had problems with knee pain and foot pain that made it very difficult for me to walk. I couldn't get upstairs without pulling myself in my own house with both hands. And now my life is completely transformed. Yesterday, I laughed out loud because I ran upstairs with a laundry basket. I didn't even touch the sides and I wasn't out of breath. My life is completely transformed and my risk of diabetes is very, very low.
So now no more a burden on the NHS and a great success story here, Nina.
Yes, it sounds like a fantastic success. The question I would ask is, what was your body mass index when you went in for the operation? How high was it?
It was nearly 50, so that meant that I was nearly twice my maximum recommended weight. I was actually nearly 26.
So that's morbid obese category or super obese. And it's quite different from what NICE is suggesting, that this operation be available at a body mass index of 30, which is quite much lower.
But so NICE basically today have changed U-turn on their guidelines, Alex, saying that the surgery that you had should no longer be used as a last resort. Do you support that? Would you agree with that?
They haven't said that in quite the way that you've described. They're talking about people who have already got diabetes. In their early stages of diabetes should be considered for surgery. Not everyone will want it. Only about 1% of people who are eligible for surgery actually want it or are suitable for it. But of those, for it is a good thing. It can put their diabetes into remission, so they don't need medication for the diabetes, care for the diabetes, which is a very great saving to the NHS. About 1/10 of the NHS drugs budget is spent on diabetes drugs at the moment. 1 in 6 beds in the NHS are used for diabetes complications. If we can get people early and prevent them developing diabetes complications, then we will actually be saving the NHS money within 2 or 3 years.
And you must see countless patients coming to see you who have got problems with their weight and also becoming diabetic. Why do you not think this is a good idea? Why would you not support it?
I don't want to encourage the public that there's an easy option, that you can eat whatever you like and don't take exercise, because at the end of the day, that we're going to offer you the £6,000 operation on the NHS. Because if we multiply that by 2 million who are eligible, that's 12 billion on the NHS. Now there are reports that only 5,000 will have this operation per year. That's 30 million per year. This is a cash-strapped NHS.
I mean, is it an easy option? Is there a concern, Alex, that people will think, oh right, I'll put a bit of weight on, I'm now turning into diabetic. It's okay though, because the NHS will sort it out for me. And there's other people that will say that's taking valuable resources away from other areas, such as treating cancer patients.
I have never met somebody who's looked on their surgery as some kind of treat that they do lightly. The NICE guidelines make it clear that everybody should be assessed by a multidisciplinary team, including psychiatrists, psychologists, including dietitians, and they have to have shown over a considerable period of time a real commitment to lifestyle change, and it's only if that doesn't work for them that they would be considered. But those people, as you know, can benefit not from their diabetes getting better because of weight loss, but some of the surgeries like the gastric bypass, which I had, can actually put diabetes into remission within days. Completely irrespective of weight loss, within days of the surgery.
We've had plenty of viewer comments on this. This is from Glenn Thomas via Facebook. He says, I'm type 1 diabetic, had a serious accident in August 2013. He's disabled as well as being overweight. I don't eat rubbish, but it's very difficult to lose weight, and surgery would actually be a great help. And so, what would your alternative be? What would your message to Glenn be if you don't want him to have this surgery?
Well, if he's tried all the conservative measures, looking at his diet, taking on exercise, spoke to his GP, looked at his medication, optimised his treatment for type 1 diabetes, and nothing has worked, I regard major surgery as a last resort, because when you're working in a system that's cash-strapped, you don't have enough nurses to take care of you post-op. What if you had internal bleeding, which is a known complication of this gastric bypass?
So you're basically saying it's common sense, eat well, exercise, cut down on booze and other things. I mean, Alex, what do you make of that advice? Because we hear that all the time, don't we?
It's great advice. It's great advice, and if it works for people, that is fabulous. Nobody would choose gastric bypass as the way to go if there was another treatment that worked for them. And if in the next few years another treatment is developed that actually is proven to work, everybody will be delighted. We're not doing this for fun, and nobody would choose gastric or major surgery lightly and without having tried other options.
We have to leave it there, ladies. Thank you for joining us. Professor Alex Blakemore and Dr.